Hope Channel, changing lives.
Hello and welcome to Family Life. At Family Life, we discuss issues that revolve around families, parents, children, whoever is part of the family, and the issues, everything that borders around families. That's what we do here. Today, I shall be sitting in for our regular host, that is Mrs. Betty Adom, and my name is Felicia Owusu Ansa. Last week, we were able to exhaust a beautiful topic, very resourceful topic, which is the reproductive health of the adolescent. The reproductive health of the adolescent. And we had a lot of education on how we as parents would teach and guide our adolescent children through the adolescent age, the issues they go through, and whatever that is around adolescent health, reproductive health. We also were able to go through menstrual cycles and when the other one is coming and all that. Today, we are going to look into teenage pregnancy and its effects. Teenage pregnancy and its effects. We are lucky to have with us one young, beautiful, but studious lady who is an expert. She really does have the expertise in the topic we are going to look into today. That is teenage pregnancy and its effects. I would like her to introduce herself to you and use one word or a phrase to tell us her mood today. So our guest here, my young woman, will tell us about her name, herself, and her mood.
Okay, thank you. I am Mekia Efriye Ampemdako. I'm a midwife.
Beautiful name. And a midwife?
Yes, please.
Wow.
I'm a midwife.
Mm-hmm. So, you know, sometimes I think about midwives. And when I reconcile it with the mystery around childbirth, people going through labor, you standing there and watching, and sometimes you don't, you don't have anything to do to help them because you can't push for them. And I wonder what kind of people, you guys are, the kind of heart you have. Can you tell us a little bit about this job?
Well, midwifery is a serious business.
It's a mysterious business.
A serious business.
Oh, serious business.
Yes. Yeah, and we aim at saving lives. Mm-hmm. Yeah, so we try to save the life of the mother and the baby.
Wow.
So it's a serious business.
Oh.
Yeah.
God bless you guys.
Thank you. Amen.
You do a wonderful job. God bless you. So today, as I said earlier, we are going to look into teenage pregnancy and its effects. Would you kindly tell us what all this is about? Teenage pregnancy. Who is a teenager, and if she is pregnant, so what? What is teenage pregnancy about?
Okay. When we talk about a teenager, we all know a teenager is a person who falls between the ages of 13 to 19. Mm-hmm. And we normally associate a teenager with adolescents. So when we talk about teenage pregnancy, it's all about a female adolescent getting pregnant between the ages of 13 to 19. Mm. Yeah, that is what we talk about when we mean teenage pregnancy. Yeah.
So let's look at it this way. In Ghana, would you say it's a serious issue in Ghana?
Yes, it's a serious issue here.
Why?
Because most people, most teenagers get pregnant, and during childbirth, a lot happens. Yes.
Okay, so we shall go into that when we get there. But what would you say causes teenage pregnancy?
With causes of teenage pregnancy, we have a whole lot. But what I would like us to talk about is some few causes, which is very common, the common ones. The first one I'll talk about is forced or early marriages.
Early marriage?
Yes. You know, in some parts of Ghana, we are in Ghana, so in some parts of Ghana here, we all know some people do give out their teenagers early for marriages. So at the age of 13, 14, 15, they are married already. Yeah. So when they are pregnant, 15, 16, 17, they feel it's accepted in the society, so it's normal, but medically it's wrong. You put the teenager at risk.
Oh, so even though the girl is married.
Yes, but it's still a teenager.
So what would you advise? For instance, we have cultures that endorse teenage marriage.
Yes.
And they also have their reasons why they do that.
Yes.
And they think, I mean, in their wisdom, or the wisdom of their culture, it is okay, it's right. What would you advise when they marry at that tender age? What would you advise in terms of getting pregnant?
Well, if they can allow them to wait, even after 19 years, when they are well matured, to go through the whole process of keeping the pregnancy till term, like till it develops. Because it's not just pregnancy as we see it. It's something that is serious beyond what we see. Yes, a whole lot of issues surround pregnancy. So if we are allowing the girl child to be well matured so that they would know that they are fully or well developed to carry pregnancy, that will help.
I was in admission in the hospital with one young lady who, according to, in fact, when she came to deliver her third baby, she was 18.
Okay.
And she said she got married at age 12. And the first day when she got to her husband's house and she got into the bedroom, she cried all night, and the husband too was sympathizing with her. So nothing happened. And the husband understood that she was, I mean, too young to have sex with her. So the husband was able to wait for 3 years before they began having sex. But she left with the guy. So she was 15, and she got 16 before she had her first child. Would you think, or do you think at age 16 is okay?
Well, you know, we have early teens. Even some at age 11, they get pregnant. 11 to 15, that's the early teens. So even after 16, 17, 18, she's a bit developed than 13 years or 12 years. So even in Ghana, you know, when you are 18 years, that is when you have your privilege to even vote. You can marry, you can do any other things like outdoor to do. So it's better, or it will be best we wait for the girl to reach at least 18 years, 19 years. That is when the whole body is developed. That is when you can decide to give out the child for marriage. Oh,
but talking about the causes, can we think of the geographical space of the person? For instance, people live in the north where we have a lot of sun, and people live in the south where we have, you know, talking about the space. In Ghana we have regions. So would you consider the geographical space of the person as a cause of early pregnancy among a people?
Yes, it's also part, because when the child is exposed to so many sexual activities, the child gets engaged in sexual activities and gets herself pregnant. And as I said earlier, forced marriages in some parts of Ghana. Yeah, so where the person finds herself to is another factor.
Another factor.
Yeah.
So, what of children that live with their parents and sleep in the same room with their parents? What do you say about that? Because it's a serious issue, but I mean, that is what they have. And they cannot say that their children should sleep outside because the parents would want to have sex or something like that. I mean, what do you think of that?
Well, you just have to know the time you would do that. Because you doing it in front of your child, you are just exposing the child to do what she is seeing, and it's not advisable.
So it is true that when they see parents, I mean, having sex, they will also try it.
Yes, some do. Talking about the causes of teenage pregnancy, I can add lack of improper upbringing, parental
upbringing.
Yes. Some parents even push their girl child outside to engage in sexual activities to bring money home so that the whole family would rely on the money the girl brings to the house.
Oh, yeah.
Yes, we know a lot. As a health worker, I've experienced so many things. I've witnessed people talking to me about what the mother is forcing them to do.
Parents, we want the good of our children. It happened to one lady I grew up with. This girl was always in the room, studying, reading her books and all that. But the mother sees other girls going out, coming in, big guys dropping them in their beautiful rides. And I think she cherished that than seeing her child in the room all the time. And when she began talking about it and asking the girl to kind of, you know, and the girl started stepping out, and in less than 3 months she was pregnant.
Yes.
Meanwhile, the other girls were going and coming, and they were, you know. So it's a real factor, and I think it's something parents should desist from it, because we don't know the plans God has for these our children. Yeah. Okay, so talking about causes. Now I would like us to look at the effect of teenage pregnancy. How does it affect teenagers, or how does it affect people?
Okay. Pregnancy, teenage pregnancy itself, it affects the mother, who is the teenager, and the baby, and the whole family.
Oh my goodness, tell us more.
When I say it affects the mother and baby and family, I mean that...
Let's look at mother first.
Okay, the mother. So the mother is the teenager who is carrying the pregnancy. Okay. So when the teenager gets pregnant, mentally, it affects her.
Okay.
Because not all teenagers want to get pregnant. Some are abused.
Oh my God.
And they get pregnant.
Yeah.
Yes. So when they get pregnant, mentally it affects them. One, some get depressed. And when you are depressed, you see the child go through some symptoms like crying, sadness, the person doesn't eat well, difficulty in concentrating, the person doesn't sleep well, that's insomnia, you can't have enough sleep, then poor eating habits, which will result in either obesity or the person will lose weight.
Does that come from regrets? Like, I shouldn't have done this.
Normally, people do regret when they find out they are pregnant. Most of them regret. Because one, maybe they wanted to explore. They didn't know
to have fun.
Yes, they didn't know it will result in pregnancy. So when the pregnancy comes, one, they are sad about it. They don't know how to even go about it. And because most of them, they are not even aware that they are pregnant. The time they realize they are pregnant, maybe they are 3 months gone, they are 4 months gone. So most of them do not access the hospital as early as possible, which is another dangerous thing.
Yeah. So we will come to that dangerous issue. But tell us, talking about the mental health of the adolescent pregnant girl, what of the guy?
Well, most of them, when they come to the hospital, it's only the female, like the mothers that you meet. You don't meet the guys. Maybe during labor, that is when you might meet the boy's parents, or even the guy will just come around. So
it's always, they leave it to the girl to carry.
Yes.
So girls, ladies, when you get pregnant at that age, you're not married. The guy is also young. You are a baby. The guy is also a baby. You are, and the guy wouldn't know what to do to help you. The guy is not working. Let's look at that. Mental health of the child or the adolescent, not the child, the adolescent who is pregnant.
Yeah. During pregnancy, so the things I said might affect the baby, and mentally it will disturb her even after delivery of the baby.
Oh, wow.
Yes. Through the pregnancy, you might be depressed. Through labor, after labor, you might experience some symptoms like baby blues. Which means getting depressed, like mood swings, anxiety, you're overwhelmed by the baby. You can't even bond well with your baby. You look at your baby and you feel hurt. You feel like the baby has maybe prevented you from enjoying all the privileges your other peers are enjoying. Meanwhile, the baby didn't ask you to produce her. Yeah. So mentally, they are disturbed. And another thing is, before pregnancy, they were enjoying their life with their peers. They were going out, having all the fun, going for all the weddings, posting pictures on social media, and now she's pregnant. So, suicidal thoughts.
Yeah. That they want to take their life.
Yes. Some try. Most of them try. Yes. Because they feel now they are no longer part of their peers. They are by force like mothers. They've been forced to be mothers. Meanwhile, they are not yet mothers.
So what would you say to these adolescent pregnant girls?
Well, the pregnancy is already there. You should just gather courage.
Yeah.
Hold your pieces together.
And
with parental support, societal support, you move on. Because you have no option than to keep the baby.
Yeah. You have no option than to keep the baby.
Yeah.
Because you may never know. I know people who nearly aborted their babies, and finally, when they didn't or they couldn't do that, finally, those babies are the only babies they have in this life. Keep that baby. We shall go for break, and when we come, we shall look at the physical effect on mothers and babies. Don't go away. Please stay. Let's pray.
We are praying together with you, and so send a praise report. What is it that the Lord has done for you?
What I will cry, Yankopon Ashadie, ne Yesu Christo Jidim.
I want Yankopon Femono, and Sabi Be Jumano. I cheat Nimpano, didn't creme rade.
Sir,
at Yana Nimpayadrian and say, the Betimia Ayano, Janjambia.
Not just a fee at the bone fit, as a fee, Edino. Nyankopɔn ni nipa wa pam. Enye se ode ma Israelfo, na mmom ni nipa nkasa wa pam.
I'm calling to pray for my family members who are outside the nation and those who are in the nation.
Let's pray. Showing this on every Friday at 6:30 p.m.
Chaplain.
Hello, Peter.
How do you do?
How do you do?
It's been a while.
Yes, it has.
I hope you're well.
Oh, yes, we are. And what about you?
Doing well, by God's grace.
All right. Thank God.
Chaplain, this reminds me. The last time at church, you made this presentation about Jesus Christ and God, and there's this question that's been bothering my mind.
Okay, let's hear it.
Who is Jesus Christ?
Okay, so as I said, Jesus is God, and then he is man.
Chaplain, this is rather confusing. I mean, how can God become man? I believe he's either God or man.
Okay, so Peter, we can have the long talk here, but why don't you join me on Hope Bible School?
Hope Bible School?
Yes, Hope Bible School. This is an interactive and in-depth study of the Bible, where Bible students study the Bible to know what it truly means.
Oh, okay, this is good news.
You can invite your friends to watch on TV or online.
You know, I'll tell my friends and family to tune in.
I'm nowhere close to
You are welcome back to Family Life at Hope TV. We have been discussing teenage pregnancy and its effect. And we have been looking at the causes of teenage pregnancy, and also we are looking at the effects of the teenage pregnancy. We have looked at the mental aspect of it. How does it affect the body? Today, my guest is Mrs. Ekia Efriye Ampemdako. She is a midwife, and she is taking us through step by step what teenage pregnancy and its effect is all about. Mrs. Ampemdako.
Yes, Mommy.
Let's look at how teenage pregnancy affects the mother physically.
Physically, when you see a teenage mother, you see that she's very disorganized. She's unstable. You know, because they didn't plan for the pregnancy, they don't know how to go about it. Yeah. So physically, they always look very tired.
Okay.
And this is when medically, since they are not getting, maybe some are not getting enough food to eat, they result in maybe bad eating habits, and some also tend to either eat more, making them obese.
Oh.
Yeah, so physically, you see teenage mothers and you see that they are not well organized. Yeah. And medically, when you see them, or even if they come to the hospital, when they come to the hospital, most of them, as I said earlier, they don't come to hospital early because they don't even know they are pregnant as at then. So when they come, 4 months, 5 months gone. Some even come in the 9th month.
Oh.
Yes.
And I'm sure even some of them, they know, but they are not able to tell their parents.
Yes, so they hide it from them. Until they get sick or some collapse, they bring them to the hospital, they do some labs, then they know that they are even pregnant.
Oh.
Yeah.
And that is why we have this kind of effect.
Yes. And if the mother is not eating well, because they develop poor eating habits, either they are eating and they are not eating well or they are overeating, the mother can develop anemia, which is low blood level. Because the baby needs an amount of nutrients. So when you take in food, the baby also take in what you are eating. So when you are not eating well, the baby is also not getting the required nutrients.
Bring your views and also your questions. So the number that you can, through which you can send your concerns is our same WhatsApp line, that is 055 968 0066. 055 968 0066. So send in your concerns, your questions, your inputs. We shall read them here and discuss them. Mrs. Ampim Dako is here. She will answer your questions and then we move on. So let's continue, Mrs. Ampim Dako.
Okay, so when they develop blood pressure, it might lead to a medical condition known as preeclampsia.
Preeclampsia.
Yes.
This big name.
Yeah,
when
you
get
about? BP, when you get BP, you see them, their legs are swollen. They have much, like, their body is a bit puffy. They even get into seizures or fits. Yeah, that is preeclampsia.
So why is it pre? Because
before pregnancy, there's eclampsia. Some even develop eclampsia itself.
Which is
like, yeah, the fitting, the seizures. Yeah. So teenage mothers mostly face that condition.
Oh, wow. So it's not a good thing to get pregnant at that tender age.
Not at all.
And you see, it's the period where you can enjoy your life. You can enjoy your adolescence, your childhood, you know, because it will get to a point when you will leave. You won't have that freedom anymore, because very soon you get married and you get tied to someone else. That is also a different experience altogether. So you need to enjoy that period when you are a young woman or a young man. You need to enjoy that before you get to the period when you get married, because you kind of become a slave to these issues. You get pregnant, apart from the fact that you are not happy and you are losing some opportunities of life, you might also get into health issues.
Yeah.
And which is a story no one wants to tell about themselves. Well, as we wait for their questions and inputs, we would like to look at the effects of teenage pregnancy on the babies.
The babies?
Yes.
Okay. A teenage mother, mostly their babies are underweight. Mostly.
From childbirth?
Yes.
Or?
No, whilst pregnant.
Okay.
The babies, whilst pregnant, you realize that the fetal estimated weight is very small. When it comes out to the baby, most of them, they are small.
Is that right?
Yeah.
Wow.
Then they have their weights being lower than 2.5. So if you have a baby who is 2.5 kg, like low birth weight, and most of the babies too, some, let me use some come out dead. That is stillbirth.
Oh, after going through all this wahala, then you deliver the baby and the baby is stillbirth.
Because one, we discussed that some do not get the nutrients required to develop. And that might also lead to some deformities, congenital abnormalities.
Congenital abnormalities.
Yes.
Congenital what is that? We are novices, most of us, when it comes to these health terms. So we'd like to know and understand what they are.
I would explain. Some, as I said, some girls do not go to hospital or antenatal as early as possible. So the drugs they have to take for the baby to develop, they don't take it. And some even hide their drugs. They don't take it when they start going to hospital because they don't know what will happen to them. So most of them, for them to take the baby so that the baby can get the nutrients required to grow and the nutrients that the baby needs for it to develop well, they miss it out. So the baby comes and they are deformed, maybe some defects, which is the cause might be unknown, but we can relate it to some don't take their drugs. You understand?
Yes.
Yeah.
Oh, I see. Okay, I now understand that. Congenital. Anyway, so what are the other effects on babies?
Well, as I said, we've talked about the stillbirth and the low birth weight, that is lower than 2.5, and most of them too can be deformed. They can get, they can come with some complications. Yes. Most of them can come with some complications like spinal bifida, because it's a medical condition where
spinal
bifida. the spinal cord of the baby do not develop well. At times it leaves a hole. Instead of it to like the muscle to cover it well, it doesn't cover up, so it leaves. You can see the spinal cord there. Most of them to teenage pregnant mothers, they give birth to those kind of babies.
Oh, I see.
Yeah,
I see. And there is one other thing that I see around teenage mothers. They seem not to like their babies.
Most of them, and it's part of the mental effects because they are depressed. They do not know how to bond with their babies. They look at their babies and they feel the babies have prevented them from some privileges they could have enjoyed. So they look at the baby. Some even want to harm the baby, harm themselves.
Oh, no.
Yeah, some do.
So unfortunate.
Yeah, very unfortunate.
Is there any risk during childbirth?
Labor. Yeah, a lot. Teenage pregnant mothers, you know, they are not well developed as compared to a matured woman. During labor, when you do that comparison, a teenage mother and a full-grown woman in labor, well, some might comport themselves and they are able to push, but some, they don't have the energy to even push the baby out. Why? That is what we call maternal exhaustion. They become very exhausted. They can't push the baby out.
They don't have the capacity.
Yes. They are not well developed. Some are not eating well. So when it comes to pushing of the baby, they can't push.
But I learned sometimes some nurses ship them with canes.
Not true.
It's not true.
No, not true.
It has, in some cases.
Well, in my hospital, we don't.
You don't?
No, we only encourage you to push your baby out so you get a live baby.
Okay.
Yeah.
Yeah, that
so
is.
we don't whip you.
Okay, so then we will encourage people to come to your hospital.
Okay. Oh. And aside that, aside the maternal exhaustion, another thing else is, you know, the perineal area. When I say the perineal area, I'm talking about the birth canal, where the baby will pass through
to come out.
Yes. That place is very small.
Yeah, because you are so young.
You are very young. You see a 12, 13, very small girl with a small hips, small waist, and you want to come and deliver a big baby. So you see, when you meet a skillful midwife who wants to help you, the person will help you by giving you a fine episiotomy. When we say episiotomy,
I'm happy you are explaining it.
it's just simple. Using we will give you local anesthesia, then we use a fine scissors.
Local anesthesia, that is, they will give you some, you know, injection
that you wouldn't feel the pains too much, but you feel it.
You feel it?
Yes. So you use the scissors to increase the birth canal, to widen the space.
So they cut?
Yeah, cuts you.
Yeah.
So that the baby can come out. And this is painful.
Yeah.
Meanwhile, a full-grown woman will just push the baby out. But you can't push the baby out. So we will just help you by giving you that fine episiotomy to widen your birth canal, to bring the baby out.
Young women, you see why you don't have to do what adults do, what married people do. Because when you do what married people do, to get to a point when you have to do bigger things that married people do, married women do, and it will be difficult for you. It doesn't help you mentally, physically, what else? Medically, everything. So let's watch out. And parents, let's not push our children out. Let's encourage them. Let's bond with them. Let's make them our friends. I know that many will say, oh, it's difficult. It's not easy to get them to come closer. But Paul says, I can do all things through Christ who strengthens me. Christ will strengthen us to do that. Risk involved in labor.
Okay. So, another risk is, since the waist or the pelvis of the teenager is very small, and the head of the baby coming out, the fetus coming out, the fetus is the baby coming out.
Okay.
It's small. It's also big, so it's kind of like disproportion, the waist and the head of that of the baby. In our term, we call it cephalopelvic disproportion. Yes, that is when the head of the baby is in disproportion to the waist of the mother. So meaning the head of the baby cannot pass through the birth canal. And in this case, we have to take you to theater to do a cesarean section.
Wow.
Yeah.
That is the one we call operation.
Operation.
In our normal terms.
Yes, yes. Yeah.
Wow.
And you know, when you do a cesarean section, it means the number of births that you would want to give, it reduces. When you are going the natural way, you can go maybe 4, 5, 6. But with CS, it's limited. 1, 2, 3, you are done.
You are done. Wow.
Yes.
All right. Pause there. We'll continue. But we have some questions here which we would like you to address.
Okay.
The first one says, can a teenage mother get a mental case?
Yes. Yes, some do.
Wow.
When you go to the mental hospitals, you get some teenage mothers there. Some even after, most of them, what I know is most of them get it after delivery. That is when you can get a puerperal psychosis. That is after delivery, because of the episode of the depression that you go through, the baby blues you spoke about, it can lead you to puerperal psychosis.
Which is like
you are so not yourself. You are depressed, suicidal thoughts, difficult to bond with your baby. You are just not of yourself. So it will lead you to, complicated issues.
Okay, so it is true that a teenage pregnancy can cause one to be beside herself. Can cause the person something wrong upstairs. Can cause the person, we will not say get mad, but we have mental issues.
Yeah.
So that is your answer. And see, Asari is asking, what can we parents do? What can we parents do to curb teenage pregnancy in our families? What can we do to curb this?
As we discussed earlier, some courses that the parents do, some are parts, some push their babies out. And teenage, that period is the period, the girls, they get, their breasts are developing, they get attraction for the opposite sex, they want to explore. So as parents, that time you should draw them closer to you, talk to them, give size scenarios for them, give them some things for them to see that this thing, if I do it, it will result in this. Give them instances. Show them people who have suffered from teenage pregnancy. Let them know that it's real. We talk about it, but people think it's far from us.
Yeah,
but if you are educating your child, your girl child, she should be your friend. Because if she's not your friend, she will go to her friends
And they would advice from them.
Yes, and they would explore what's on the media. They want to trend. They want to trend. Yes, they want to follow what the celebrities are doing. When there's a sex tape leaked, they want to watch it, see what is going on.
Yeah,
you know, they want to try. So if you are talking with your child day in, day out, the child will be so comfortable coming to you, mommy, this and that and that. Do I do this? It's not difficult.
Does that mean we should have such discussions on sex with our teenage?
Yes, we should do.
Which is something parents normally don't do.
Yes, but we should do it. We should encourage it. You should know what and what you want your daughter to know. It shouldn't be about sex, but then you can pinpoint some effects of what she would result into when she does that thing. So that whenever the person wants to do it and it's just bringing the bell, then you, oh no, I wouldn't do this. But if you don't give the child the chance to come to you too, your child will not come closer to you.
Yeah, it is true. And it is also true that many a time at that age, either they are irritating, I mean, from the parents' point of view, or the parents are irritating from the adolescent's point of view. And so we have to be persistent in trying to make them our friends. Otherwise, you try once, twice, and they are not giving in, then you give up.
Yeah.
So it is important that we are persistent and in finding ways of making them our friends, if they are not our friends yet. The other question says, this one is Mark Nyande. Mark says, good evening. We are grateful for the comprehensive education on teenage pregnancy and its effects. I want to know if it would be possible to have a zero teenage among our youth. Is it possible?
With Christ, everything is possible.
Amen.
We have to start from somewhere.
We start from somewhere.
Yeah.
We start from somewhere. It is possible. There's nothing that is impossible in this life. It is possible. But as Mrs. Sampim Dako said, we start from somewhere.
Yeah.
One day at a time. Okay. The other question is, please, can adolescent mother give birth to twins? That is from Fuakwa Raymond, from Swaman.
Yes, they can.
Yes,
but mostly it will be through a cesarean section.
Yeah. So mostly they can.
Yes.
But many a time it will be through
a cesarean section.
They have to cut.
Yes.
Your stomach. Okay. So the last question here says, one example of a congenital abnormality.
Spinal bifida.
Spinal bifida.
Yeah.
Spinal bifida. That's the one you explained.
Yes.
Okay. So are there any other risk you would want to talk about?
Yeah. I would also want to talk about the effects after delivery. As we are talking about the puerperal psychosis, which affects the teenage mother so bad. When they are depressed, you see, with the baby blues, it can last up to 2 weeks after delivery. That's when they have the panic attacks, mood swings, they are not of themselves, they look at their babies and they want to hurt the babies. They can't sleep well, they can't eat well. But it can prolong till 6 weeks.
Oh, okay.
That is when the real proper depression sets in, which might lead to the puerperal psychosis I spoke about. Yes, it affects the teenage mothers.
So, you see, we always do the education many a time for girls. But it is I mean, it's a two-way affair.
Yeah.
Boy and a girl meet and then they do it, have sex, and then this teenage pregnancy comes about. Sometimes young girls and even elderly men and all that. What are we doing about the guys?
As we are educating the girls.
And what can we say to the guys?
Well, as we are educating the girls, we can also educate our boys. And it's all about this parenting. So if you are educating your girl child not getting pregnant, you educate your boy not to get anyone pregnant, to focus on school. Because at the end of the day, when the girl is pregnant, school dropouts, the boy will continue. But then you educate the boy to know the implications of what he has done.
Yeah.
Because mentally he will also not be okay.
Okay, so I was going to ask you if it doesn't have any effect on the guy.
You too, you'll not be mentally all right because you know that you've put someone in a situation, and most of them too, maybe their parents will not support the ladies.
Yeah, that is true.
Yeah,
that is
so
true.
you also know that you should know that what you've done to someone else's child is bad. So you should advise our boys to refrain from that. To refrain from that.
Thank you very much, Mrs. Ampem Dako. I would like to also find out if there are any risk or negative effect talking about the cutting.
Well,
not the CS,
but the episiotomy. Okay, with the episiotomy, one thing is when we give you an episiotomy, it means the subsequent delivery, there's a scar there, and you know a scar cannot stretch. When you are laboring, all your perineal area, the birth canal, it stretches so that the baby will come out. So once there's a scar, it cannot stretch fully. So there will be a crack. And teenage mothers, they have deep tears, deep tears or cracks during delivery.
That is the delivery after the first delivery?
No,
or
even the first time.
Yeah.
Most of them have deep tears.
Because even the matured women can have tears.
Yes. So with the episiotomy, when we give you the first one, it means you already have a scar. And as we know, a scar cannot stretch. So definitely you are going to have a crack or tear the next time you are going to labor. If we don't give you another episiotomy, that episiotomy scar will just tear itself.
So if you are giving another episiotomy, are they going to cut the same place or they'll cut another?
It wouldn't be the same place, but then it could be maybe closer.
Closer?
Yeah.
And then you stitch again?
Yeah, we'll stitch again.
And then another scar?
Another scar.
Wow. Okay, that's
but then it will
question.
heal. It will heal.
It will heal.
But the scar will
be there.
But
the scar will be there?
Yes.
There's a question. It says, please, why is it that those who undergo CS cannot give birth to more or many children?
Well, you know, let me use the word cut. We cut. It's not the abdomen that we cut. We cut the uterus. The uterus is the womb, that where the baby is. So
after cutting the skin here, outer skin, then you cut the uterus.
Yes. So afterwards, there's suture, and it takes time for it to heal. So the uterus, once it's cut, there's a scar. The next pregnancy, you see, when the uterus is like this, maybe the uterus is like this, and there's a baby inside, the baby comes out, the next one, the baby goes, it will be bigger. So it wouldn't be the same as the first, the normal size. So once you are cutting 1, 2, 3, the uterus becomes very lax. Like, yes, you cannot be cutting it like that. I hope you are getting me.
So you cannot cut all the time. Like you
because
cut today.
It's like a wound, so it has to heal. So 1, 2, 3, you are done. Some would go the extra mile to do the 4, but that one, it takes a specialist to do that.
So it's not advisable to go more than 3?
Yes, ideally, it's not advisable.
So is it possible that after the first CS, the others, I mean, the continuing child birth, you could have a normal delivery?
Oh, yes, you can. But then you would have to wait for some years. Yes.
For the scar to heal altogether?
Well,
right?
well, it's not, well, it's part. But then you have to wait for some years, because once the uterus is sutured, it's not well, you know, like healed. And when you get pregnant, immediately after the first CS, maybe 1 year or 1.5 years after the CS, it means when you are pushing, the uterus might get, like, you know, tear. Like, yeah. So you have to go through another CS. But if after delivery, say you wait for like 3 years, 4 years, and the size of the baby too is small, you can push, they will allow you to try the vaginal birth.
Oh, okay.
Yeah.
All right. So it means that if you went through CS, you want to have a normal delivery,
yes,
you must wait for after about 3 years.
Yes, your doctor would discuss that with you, and they would decide if all the factors that they have to check are okay.
Okay.
Yes, they will allow you to do the trial delivery. Then they will try you on that.
Okay. All right. So you have to discuss that with your doctor.
Yes.
You don't decide.
You don't decide yourself.
Yeah, this one I'll do it once, because you don't know what is in there.
Yes.
You have to decide that with your doctor. There's another question here. This one is coming from Martha, and he says, she says, please, I'm an adult, but want to ask this question. Can a woman get pregnant 3 months after birth with CS, even though she is not menstruating?
Yes, you can.
You can?
Yes.
Wow.
Yes,
and what, are there any complications?
Yeah. Yes, a lot of complications. You know, we have this a short birth interval. When you give birth, and when you give birth and you have to wait for, you know, that's why we have family planning. But well, you know, you cannot always rely on family planning, and some also do not practice it. So maybe some few months after delivery, they find themselves pregnant again. That short birth interval after CS, it's risky. So that one, you have to see your doctor. Then the doctor would see if you can keep the pregnancy.
Wow.
Yes, that one you have to discuss with your doctor, because 3 months after CS, you have to talk to your doctor.
So that if you have to keep the pregnancy,
yes,
he will guide you.
Yes, because it's not as simple as that. Yeah.
Wow. So, what are some of the complications? I mean, when you get pregnant after a few months, you know, of delivery, what are some others? What are some other complications that one may?
Oh, well, it's not really, we don't have much complications like after maybe a short period, you getting pregnant again. But the thing is, it depends on the career. It depends on the career. If you are able to carry the pregnancy and your health conditions would permit you to carry the pregnancy, it also matters. So there are a lot of factors that we consider before we would say it's good or it's bad.
Okay.
Yeah.
All right. So what would be your advice? I think we have exhausted the questions here for now. So what would you want to say in general about what we have discussed here? Teenage pregnancy and its effects. What do you have to say to parents and the teenagers?
Okay. To parents, I would say you should talk to your girls, draw them closer to you, let them know what the real life is about. Let them feel comfortable around you so that they can confide in you, tell you all their problems so that they do not surprise you.
Okay.
Yeah. And my
We
teenage
don't want
friends.
surprises.
Yes, and my teenage girls too. The best thing is to abstain for now. Abstain. And unfortunately, if you find yourself pregnant too, you have no option than to keep it. Gather your pieces together. Gather them, you know, and forge on. It is well. Great.
It is well. Thank you very much, Mrs. Equia Efriye Ampem Dako. Nana Equia.
Yes, ma'am.
God bless you and keep the good work up. She said it all, and we don't have much to say again, but I know that you already know more and you have learned something from here. But I would also want to say that let's get closer to our teenage people, our teenage children. They are no more children and they are not adults. So that is the most confusing part of life, because we call them children. They don't like that. And we don't want to call them adults. When they do things, certain things, we say, you are grown and you do this and that and that. When they do other things, you say, you think you are growing, eh? Very confusing. What do we do? Let us get close to them. Let's make them our friends. Let's give them pieces of advice and pray for them. That is what we can do for our children. Let's pray for them. So I am your servant, Felicia Owusu Ansa, and today I sat in for Mrs. Betty Adum, our regular host for Family Life. And our guest has been Mrs. Equia Efriye Ampem Dako, a midwife. We are grateful to you all, our viewers, for being here with us and studying with us and also interacting. You've been a wonderful audience. God bless you, and we hope to meet you again next week. So next week, please let's call our friends and our families and our everybody. Hopefully, we shall have a very resourceful discussion next week. God bless you for being with us. Have a good night.